All right, today we're talking about a virus with a name that tells you exactly what it does to you. Chikungunya. This is a mosquito-borne illness that's been making its way around the world, and it brings with it some truly severe pain. So yeah, let's get right into it.
So just imagine for a second, a pain so bad it literally bends your body out of shape, forcing you to hunch over. And no, that's not some kind of exaggeration. It is the brutal reality for people who get this disease, and it's actually where the name comes from.
And boom, there you have it. The word chikungunya, it comes from the Makonde language in Tanzania, and it literally means that which bends up. I mean, you can't get a more direct or, honestly, a more chilling description of the joint pain that this thing causes.
Okay, so let's break down what this bending disease actually is. What are we really looking at when we talk about the chikungunya virus?
So the bad guy here is the Chikungunya virus. We can just call it CHKV for short. It belongs to a group of viruses called alphaviruses, which, are often spread by insects. And its number one accomplice? The mosquito. Once an infected mosquito bites you, bam, you get a sudden, high fever and, of course, that absolutely awful joint pain we've been talking about.
This thing wasn't always a worldwide threat. For a long time, chikungunya pretty much stuck to parts of Africa and Asia. So how in the world did it go global? Well, it's a story that really involves two main characters.
Think of it like a heist. You've got the mastermind. That's the virus itself. But every mastermind needs a partner in crime, right? In this case, it's the getaway driver, the accomplice that shuttles the virus from one person to the next, the mosquito. And we're not just talking about any mosquito, but a couple of really common ones.
Okay, meet the main culprits, Aedes aegypti and Aedes albopictus, which you might know as the Asian tiger mosquito. And here's the scary part. These guys aren't specialists. They're the same mosquitoes that spread dengue and Zika. What makes them so dangerous is that they absolutely love living where we live. They're perfectly happy breathing in tiny little puddles of water right in our own backyards.
And this timeline really shows you just how this thing exploded. I mean, look at this. It was first found way back in 1952 in Tanzania. And for decades, it was kind of just there, a regional problem. But then 2005 happened. The virus mutated. This one little change basically supercharged its ability to multiply inside the Asian tiger mosquito. That mosquito became a super spreader, and bam, you get a huge outbreak on Réunion Island. After that, the dominoes just fell. By 2013, it hit the Americas, and now it's everywhere.
So we know the virus is global, but what does that mean for you if you get bitten? What does an infection actually feel like? Well, it usually happens in phases, and it starts with some really acute, intense symptoms, but unfortunately, it can lead to some very long-term problems. Okay, it's a three-step process, really. Step one is the bite. An infected mosquito gets you. Then, after a few days, could be up to 2 weeks, the acute illness hits, and it hits hard and fast. But here's the kicker. For a lot of people, the story doesn't end there. They slide into this chronic phase, where that awful joint pain, it just sticks around.
So when that acute phase kicks in, you'll know it. We're talking a high fever, a nasty rash all over, muscle aches, headache, the whole works. But the real headliner, the symptom everyone talks about, is something called polyarthralgia. Fancy word, right? It just means severe pain in a bunch of your joints at once, especially your hands and feet. And when I say severe, I mean it can literally put you out of commission. Doctors also tend to see something called lymphopenia. That's just a dip in your white blood cell count. Now here's where things get confusing and actually pretty dangerous. Remember how the same mosquito spreads all these viruses? Well, the symptoms can look alike at first, which makes it tough to diagnose. But telling them apart is absolutely critical. For chikungunya, the big red flag is that insane joint pain, and the long-term risk is crippling arthritis. With dengue, the main fear is bleeding and shock. It can kill you. And with Zika, of course, the worst-case scenario is birth defects.
And I really want to hammer this home. When we talk about the long-term problem, we're not just talking about feeling a little sore for a few weeks. No way. For a whole lot of people, this post-chikungunya arthritis can drag on for months or even years. It completely changes your ability to live a normal life. All right, so this virus is nasty, it's painful, and it can stick around. So how do we fight it? What tools do doctors have to take on an active infection?
Which brings us to the million-dollar question, right? For something this widespread and this awful, there has to be a specific cure, a silver bullet drug, or at least a vaccine, right?
Nope. There isn't one. It's a pretty brutal answer, but it's the truth. We have no specific cure, no antiviral drug that targets chikungunya, and as of now, no widely available vaccine. So that means treating it isn't about killing the virus, it's just about managing the misery it causes.
So treatment comes down to what we call supportive care, basically making you as comfortable as possible while your body fights it off. That means lots of rest, tons of fluids, and pain meds like acetaminophen. But, and this is super important, doctors will tell you to stay away from things like ibuprofen or aspirin until they've ruled out dengue. Why? Because those drugs can make bleeding worse if you actually have dengue, and that's a risk you just can't take.
Okay, so if we can't really treat the virus itself, the entire game changes. It becomes all about prevention. Your absolute best defense against chikungunya is making sure you never get bitten to begin with.
I want you to just look at this number for a second. 38%. It might just look like a statistic, but what it represents is genuinely terrifying.
Here's the story behind that number. During that huge outbreak on Reunion Island, almost 4 out of every 10 people on the entire island got sick. Think about that. That's an insane attack rate. And it's why prevention isn't just, a nice suggestion. It's an absolute necessity if you live anywhere near these mosquitoes.
So, what can you actually do? This is your prevention toolkit, and these are all things you have control over. Use a good insect repellent with DEET. Wear long sleeves and pants when you can. Make sure your window screens don't have holes. If you need to, sleep under a mosquito net. But the biggest one? Go on the offense. Get rid of any standing water around your house. We're talking flower pots, buckets, bird baths, old tires, anything that holds water is a potential mosquito nursery. Dump it out.
When you look at the whole story of chikungunya, it's a really powerful lesson, isn't it? It reminds us that sometimes the best defense, the most effective treatment, is simply not getting sick. So the only question left to ask is, are you prepared?